All right, so now we're on for chapter 2, which begins on page 25. And just to remind you, remember to review the core concepts and the objectives at the beginning of the chapter. And also a good idea to know the key terms on page 26. Key terms including contamination, critical incident stress management, decontamination, hazardous material incidents, multiple casualty incident, pathogens, personal protective equipment or PPE, and standard precautions. So we'll begin with the well-being of the EMT. This is a somewhat of a stressful situation at times that you find yourselves in, or that other people find themselves in. You're there to help calm the chaos, but it does involve just a little bit of stress for the average EMT. It's important for you to deal with that stress and keep yourself prepared for any demands and risks that you may come in contact with. If you're unable to function for any reason, then that means that the patients may not get that needed care. So, eat right, maintain a healthy weight, exercise. That'll help you to balance out your stress. So, maintaining solid interpersonal relationships, that helps you if you've got a strong support system, friends, families, colleagues. Those people that are there for you during difficult times. Exercise, it helps you to stay healthy, helps you to build strength, improve your flexibility. It's also important in a good weight management program. Get the right amount of sleep. Rest is very important. You can never make up for lost sleep. Just remember that. So always try to get enough sleep every night. It helps you to strengthen your immune system. Eat right. Eat healthy. Sometimes the junk foods that you think taste so good might actually be harming our bodies and wearing it down. Limit alcohol and caffeine intake. Exercise or excess of alcohol or caffeine actually is going to reduce any performance, and it also might be just a short-term pick-me-up, but eventually in the long run it kind of wears you down. And then go to your physician regularly and keep up to date on your vaccinations. Personal protection equipment. Standard precautions is the term that we use that means we're protecting ourselves from pathogens. A pathogen, know that term. It's an organism that causes infections, such as a virus or bacteria. And we actually do what we call BSI, body substance isolation, when we perform a scene size up. Our protection is one of the biggest things we can do to help others, is to help ourselves so that we can be there for them when they need it. So scene size up and protocols provide information on what specific precautions we can take to protect ourselves from pathogens. The OSHA, Occupational Safety and Health Administration, has issued strict guidelines about precautions to help reduce the exposure to any bloodborne pathogens that you might come in. Now, if it's a bloodborne pathogen, that means it's a organism that can cause an infection and it's transmitted through the blood. So if you come in contact with blood and it gets inside your body somehow, then that is a bloodborne pathogen. They also have airborne pathogens, which are infection or bugs that are transmitted throughout the air. So it's actually spread through tiny droplets that are sprayed during breathing, coughing, or sneezing. And then they're absorbed through your eyes or any mucous membranes or your mouth when you inhale. Standard precautions is what you use to protect yourself from these substances. It's also known as body substance isolation. And this is a list of personal protective equipment, or PPE, that we could utilize to help protect ourselves from any pathogens we come in contact with. Standard precautions would include gloves, masks, goggles. So protective gloves, always have vinyl or other non-latex gloves readily available. Latex gloves have been known to develop allergies, and people can have severe allergic reactions from coming in contact with latex. And gloves should be changed when you move from one patient to another one. Don't use the same gloves when you're working on two different patients. Personal protective equipment goes into appropriate containers. If it's grossly contaminated, it's got a lot of blood and such on it, then it would go into a red biohazard bag. Hand cleaning is the best thing you can do. It's considered the most effective thing you can do to protect yourself, is a good thorough washing. If you don't have hand washing capabilities at any particular time, you can use alcohol based hand cleaners just as a short term fix until you do get to somewhere where you can wash your hands thoroughly. So washing hands is the most effective in reducing exposure to contagious diseases. And alcohol hand cleaners are effective and often available when soap and water are not, but not quite as effective as good hand washing. Eye and face protection. If you're around something that some contaminants that might possibly carry pathogens that might splash or spatter or spray into any body opening you have, then you should provide some protection, personal protective equipment from it, including goggles or masks. And this is a NIOSH approved respirator. So if you suspect that a patient has tuberculosis, then you would use something we call a HEPA respirator. It's a high efficiency particulate air respirator, and it's specific for the airborne pathogens, and it filters fine particles. Masks. So in cases when there will be blood or fluid splatter, wear a surgical type mask. In cases where tuberculosis is suspected, wear an N95 or high efficiency particulate air respirator, which is approved by the National Institute for Occupational Safety and Health. And for more about HEPA masks and the standard for NIOSH, you want to turn to page 32 and be sure and be familiarized with that as to when you would wear a regular surgical mask or when you would wear a HEPA respirator. Now, another thing I want to point out, it used to be, if you look on page 33 where it says note, when I was first trained as an EMT back in the 1980s and 90s, there was emphasis on wearing your body substance isolation, your BSI, or your personal protective equipment. And every call we wore gloves. And only if there was a lot of blood or the potential for spatter would we wear masks and goggles. But nowadays, providers have a more realistic attitude about standard precautions. So if somebody doesn't have broken skin or blood or anything that could possibly get into inside your body, then it may be that you might not have to wear gloves. So if you read just a little bit under that note, today's providers have a more realistic attitude about standard precautions. Think back to your last physical exam, for example. Your physician most likely examined your eyes and ears, palpated your abdomen, and performed other exams without gloves. Why? Because it's not necessary to wear gloves if your skin and the skin of your patient is intact. So, in addition, wearing gloves while you exit the ambulance carrying equipment and enter a scene may cause the gloves to rip before you reach the patient, and then they wouldn't be effective. So, just remember to wear gloves when necessary, which is actually most of the time anyway, or goggles when needed, and masks when you're around gross contamination. Gowns, and may also wear a gown to protect clothing and bare skin from spilled or splashed fluid. Some diseases that you should be concerned with, and turn to page 33 to uh, review this. Hepatitis B and C. Hepatitis is a liver disease. It's it's an infection that causes inflammation to the liver. And there's a lot of different forms. There's hepatitis A, there's hepatitis B, and there's hepatitis C. Hepatitis A is acquired primarily through contact with food or water that is contaminated by stool or feces. And that's why there's such an importance in restaurants that hand washing is required, because you don't want to transmit hepatitis A by not washing your hands after you use the bathroom. Now, hepatitis B, though, is can be deadly. It's killed hundreds of healthcare workers each year, so it's most likely the disease to be transmitted uh, in the healthcare setting. It can live on surfaces in dried blood for several days. Hepatitis B has a vaccination available, and hepatitis C has no vaccination, but it has the same risk. Tuberculosis, it's an airborne disease. It infects the lungs. It's highly contagious. And this is especially true and especially prevalent in institutions like nursing homes, correctional facilities, or homeless shelters. There's an increased risk of TB in those settings. So, know the signs and symptoms of tuberculosis. You can look and see on page 34 and review some of the symptoms when it comes to tuberculosis. HIV attacks the immune system. It leaves the patient unable to fight off an infection, and it can actually lead to AIDS, which is the condition that results when the immune system has been attacked by HIV. And it is a transmitted disease. It is a blood-borne transmitted disease. AIDS is a lower risk for healthcare workers than hepatitis or TB, and contact with blood is the usual route for infection.
AIDS is the final stage of human immunodeficiency virus, HIV disease. The virus attacks the immune system and leaves the body vulnerable to a variety of life-threatening illnesses. Common bacteria, yeast, parasites, and viruses that ordinarily do not cause serious disease can cause serious or fatal illnesses in those with AIDS. The Centers for Disease Control, CDC, and Prevention defines AIDS as beginning when a person with HIV infection has a CD4 cell, also called T cell, count below 200. AIDS is also defined by the opportunistic infections and cancers that occur in someone with HIV infection. AIDS is the fifth leading cause of death among persons between ages 25 and 44 in the United States. More than 47 million people worldwide have been infected with HIV since the start of the epidemic.
We now know that HIV is not transmitted through casual contact, but rather through the exchange of certain bodily fluids: blood, semen, vaginal secretions, and in some cases breast milk transmitted from infected mothers to their nursing infants. Exchange of such fluids is most likely to occur during unprotected intercourse or through multiple use of injectable needles.
Those at highest risk for HIV infection include homosexual or bisexual men engaging in unprotected sex, intravenous drug users who share needles, the sexual partners of those who participate in high-risk activities, infants born to mothers with HIV, and people who received blood transfusions between 1977 and 1985. There is no cure for AIDS, but several treatments can delay the progression of disease and improve quality of life. Antiviral therapies suppress the replication of the HIV virus. The newest treatments involve a combination of several antiretroviral agents, called highly active antiretroviral therapy, or HAART. It has been highly effective in reducing the number of HIV particles in the bloodstream. This can help the immune system recover and improve T cell counts.
Another disease of concern would be Ebola, which is one of the newer diseases that's out there. It started, people in the U.S. started getting infected in 2014, but now it's even spreading and becoming closer and closer to our area. It also causes hemorrhagic, so it's a hemorrhagic type fever, which means that there's bleeding involved in hemorrhaging when the disease actually gets going. So you might see signs on somebody that has Ebola, includes bruising. They might have internal or external bleeding. The one question that's always asked in hospitals now to try to determine the risk of Ebola is whether or not they've traveled outside of the country. SARS is another one that's traveled, that spreads through respiratory droplets, and also what's called MERS, which is found primarily in the Arabian Peninsula. The avian flu, found in poultry. This can affect humans too. It's not easily transmittable from human to human, though. Influenza, this has been around in different forms for hundreds of years, and it still spreads quite easily, which is why a flu shot is a recommended protection every year. EMS and other healthcare personnel are at high risk of coming in contact with infectious diseases. So OSHA has put in place guidelines for workplace safety. And there's federal, state, and other local agencies that help. And if you look on page 36, it talks about a lot of the infection control laws and the guidelines. One to really pay attention to is the Ryan White Care Act, which you will find on page 37. The OSHA standard on bloodborne pathogens is requires infection control to be joint responsibility of the employer and the employees. And so when you're working in EMS, and even volunteers for a limited amount are offered vaccinations. And one of the required vaccinations is for hepatitis B. And that's a common vaccination now that's, I think, required with school. So most people are have that vaccination. It's required that each agency have an infection control plan and adequate education and training and a procedure actually to go through when somebody comes in contact with a bloodborne pathogen. Such it's also required to be offered the hepatitis B at no additional cost to that person, to provide personal protective equipment, and to control the spread of infection, and to do good housekeeping and keeping your equipment clean, and label if there is any potential to exposure. And there should also be a post-exposure evaluation and follow-up. On page 38, there is a list of infectious disease exposure procedure. There's a little bit difference, such as airborne infection versus a bloodborne infection. And this is all promoted through the Ryan White Care Act. Ryan White was actually a little boy that had become infected with AIDS, specifically through a blood transfusion. He was a hemophiliac and he had gotten a blood transfusion and he died. And they actually did pass a law, though, that required a procedure for somebody if they are exposed to infectious disease, that they can have a follow-up and be notified. And this is the procedures as they're put in place. Now, if it's an airborne disease, if you were to transport a patient who is infected with a life-threatening airborne disease like TB, but you're not aware that the patient is infected, then the medical facility might diagnose it later down the road. Then they must notify your medical or your designated infection control officer within 48 hours of diagnosing that patient with an infectious disease. So let's say that you transported somebody who was having, he was coughing up mucus or other fluid, he was coughing up blood, he's had weight loss and loss of appetite and lethargy and weak, night sweats and fever. And if you want to see a list of those symptoms, look on page 39 in the last paragraph, second to last paragraph, just before the note. And those are the signs and symptoms of TB. Productive cough, you're going to be coughing up mucus or fluid, coughing up blood, weight loss or loss of appetite, lethargy and weakness, night sweats and fever. Then they might possibly have TB. But you don't know that. You think they might have the flu. So you transport them to the hospital, but when they get to the hospital, they get diagnosed with TB. It's the responsibility of that medical facility to notify your designated officer within 48 hours that you were potentially in contact with somebody with TB. And then your employer is going to arrange for you to have a follow-up by a doctor or other healthcare provider. A little bit different with a bloodborne infection, because with a bloodborne infection, then if you come into contact with blood or body fluids of patient and you might think they're infected, then you can go to and seek immediate medical treatment, document the incident for workers' compensation, but then ask them to determine if you've been exposed to an infectious disease, and they'll look at the patient's paperwork and labs and stuff, and the medical facility will look and see, and if there is a reason to suspect that they have an infectious disease, they would let you know that. They would notify the findings. It doesn't require that they actually can go and get blood work from that person, but they can look at their medical records and see if the potential exists, and then notify you if it does. The Ryan White Care Act allows EMS providers to find out if they have been exposed to potentially life-threatening diseases while providing patient care. The designated officer for your organization will gather the facts about any potential exposures. There's 2 ways to be notified: airborne disease exposure or bloodborne or other infectious. And once notified of an exposure, the employer will refer you to the healthcare professional or a follow-up. There is a tuberculosis compliance mandate. OSHA's respiratory standard requires that you use the HEPA respirators when carrying or transporting a patient with TB. So usually they're labeled, they say like N95 or HEPA on them. When you are caring for somebody that has TB, you need to be wearing those. Regular surgical masks will not filter the TB particle. Carrying or transporting a patient with suspected TB, wear those anytime you're in a closed vehicle or when you're performing high-risk procedures such as intubating them or suctioning their airway or something like that. Be sure you're up to date on your immunizations. The recommended immunizations for healthcare providers is hepatitis B for sure, because that's one of the more common ones you might come in contact with. Regular TB testing should also be done. Just to get you a baseline, when you're first hired, you should have a little test, and it's a little bit of vaccinations put underneath your skin. It's not a vaccination, it's a little test, and it's put underneath your skin, and you watch it for 3 days, 72 hours. If you see any reaction to it, then you test positive, and then you need to go and be evaluated further, have a chest x-ray and labs and such. Other things that an EMT might need to maintain their well-being is to monitor their emotional status and any stress. Stress is common in this field. It's inevitable when you're working in such a high chaotic environment. So recognizing signs of stress and then developing good positive strategies to deal with stress are very important to the EMS person. There's a lot of aspects physiologically that happen to your body when you're exposed to stress. First, it happens in stages. First stage will be the alarm reaction, fight or flight. Second stage is a resistance or a coping type mechanism, and then third stage is an exhaustion with the loss of ability to resist or adapt to that stressor. Types of stress reactions may occur as the result of a critical incident, and you're going to a mass casualty that involves little kids, a school bus wreck, and that would trigger a strong emotional response. So any type of critical type incident, and sometimes that can happen just in your personal lives if you've had something traumatic happen to your personal life, and it can start trigger your stress. Now, when the first stage happens, the alarm reaction, your sympathetic nervous system increases activity, and this is what's the fight or flight syndrome. When the sympathetic nervous system increases its activity, then adrenaline is released. We all know from talk that when adrenaline is released, things speed up in our body. We can be like Superman when our adrenaline is working correctly. An acute stress reaction. This is often linked to catastrophe. It occurs in EMTs and patients both, and signs and symptoms will develop soon after the incident takes place. It can have physical or cognitive or emotional and behavioral symptoms. So it can affect the way you think, feel, your behavior, and sometimes you may not even be able to function. It's a normal reaction, though, to an extraordinary situation, and sometimes it might require professional intervention. A delayed stress reaction would be a post-traumatic stress disorder, somebody that maybe went through something traumatic, and then they think they've been okay, but down the road they develop signs and symptoms until long after the incident has happened. Delay in dealing with this makes dealing with the reaction a whole lot harder. People suppress some of the emotions and feelings, and they may not even recognize what's causing the problem because it's their stress has happened so long ago. It probably requires intervention by a mental health professional. Accumulative stress is a buildup of stress. It results from long-term, sustained, slow levels of stress. If you're in a job you hate, you probably are developing a long-term cumulative stress reaction. Early signs to this would be vague anxiety, and you really don't know why you're feeling anxious, emotional exhaustion, you're always feeling tired, and it takes a while to build up, and you may not even notice it, but physically it can affect your body too. Your hair can start falling out. You can maybe have a little bit of anxiety or palpitations on occasion. So it can progress to those physical complaints. Loss of emotional control, person can be irritable, they may be depressed for long terms, may be very moody, might be withdraw from society, have suicidal thoughts, and this might require a long-term psychological intervention. Causes of stress: multiple casualty incidents, anything that really is overwhelming to a person. Calls involving infants, those are always very stressful because nobody wants for a little kid to be hurt or to be critical. Severe injuries, somebody whose arm was amputated sometimes can cause a lot of stress. Abuse and neglect cases, death of a coworker are all very traumatic things to deal with. There are two types of stress. Know these terms. Eustress is a positive form of stress. It's a form of stress that can motivate you to do something. So this actually helps people to work under pressure and respond effectively. A form of that, if you in it may work for some people, may not work for others. Different things can cause positive stress. But sometimes when you get ready to take a test, if you set your test date, that gives you a little bit of pressure to study and perform so that you're able to accomplish the task that you want. Distress is a negative stress. It causes immediate and long-term problems with health and well-being. So you're either going to negatively motivate somebody or positively motivate them to get things done. Signs and symptoms of stress that most people feel when they're feeling some of the negative stressors. They'll become irritable. You won't be able to concentrate. You'll see changes in daily activities, anxiety, indecisiveness, guilt, isolation. They may have a loss of interest in work, especially if they've loved their work in the past. So, if you're working with somebody and they begin to show signs of stress, what should you do? Well, probably one of the easiest things to do is to try to help them, talk to them a little bit, and see if there's anything that can help to reduce their stress. And sometimes they may just need pointed out that they're under a little bit of stress. So what possible risk could there be to your partner, you, or patient if stress is left unresolved? Well, it's not only hard to work around somebody that's irritable and under a lot of stress, it's also not good for them or their body. Do you have an obligation to act to help your partner? I think it's the morally right thing to do. Sometimes they don't want help. Just being helpful to them might help to alleviate some stress. And there's nice things you can do with people without pointing out that, hey, you're under stress. But sometimes when they're into burnout stage, they might need that. Sit down and say, hey, it looks like you're under a lot of stress. Is there something I can do to help? Some ways you can deal with your own stress. Positive ways. Develop more healthy and positive dietary habits. Stay away from the caffeine. Stay away from the junk food. They actually wear your body down. Exercise more. That releases endorphins in your body that actually help keep you positive. Devote a specific time to relaxing. Change a shift or location for maybe a lighter call volume. If you're working at a heavy call volume service, maybe switch and see if there's a lesser or lighter area that you can move to. And spend more time with your family, as long as they don't provide much stress. Critical incident stress management. If you've had an actual critical incident that stressed you out, is actually a comprehensive system. Maybe if you responded to a call that had a baby involved, and the whole group is kind of stressed because a baby died, then the management team might be able to come in and give education and resources to help you to deal with the stress appropriately when it occurs. So another quicker form of critical incident stress management would be what's called a CISD. It's a critical incident stress debriefing. It's designed to help responders kind of diffuse or let it go and talk about it. Within 24 to 72 hours is when a debriefing or diffusing is done, to help them get it off their shoulders and maybe get it out so that it doesn't cause a cumulative stress. Understanding reactions to death and dying. A lot of people see dead people very frequently, and it's not normal to see people die. So why would an EMT be any different? It's an often difficult part of the job. And dealing with family might even be more difficult if that person happens to be somebody in your family that dies. It's in even a more increased stress state. So, understanding your reactions to death and dying, these are the stages, emotional stages of the reactions to death and dying. And it starts with a denial. Generally, the patient denies that he's dying. He puts off dealing with the inevitable end of the process. And he'll say, "No, not me. This isn't happening to me." Doesn't believe it. This impact, this these emotional stages can happen to you or to others. It's a natural progression of dealing with death and dying. It may happen a little bit at a time over stages. If it's somebody that's been diagnosed with cancer, it may take a year to go through these stages. If it's something more quickly, it might happen, maybe within weeks or days. But the second stage is anger, where they say, "Why me?" This is where they're angry at the situation. They may vent on family or friends. And then they go to the bargaining stage. It's like, "Okay, I understand this is going to happen to me, but first let me see my daughter graduate, or first let me, go skydiving," or they start thinking of things that they want to do before they die. And then they get depressed. "Okay, but I haven't done this. Okay, so I'm going to die." But they're sad and depressed because there's things that they have not accomplished or dreams that aren't going to come true for them. And then the final stage is acceptance. And this is where they accept that the inevitable is going to happen. And it's okay, I'm not afraid. Understanding those emotions and the stages that people go through is going to help you in being empathetic and being tolerant of these stages. During the stages, you'll be able to recognize the patient's needs. Be tolerant of angry reactions from patients or family members. It helps you to listen empathetically. You don't want to reassure them or lie to them. You want to have your patients trust. Just offer comfort to them and be as realistic as you can and empathetic. Scene safety. EMS not usually is a dangerous situation, but there are times when you might run into some dangerous, potentially dangerous things. So you've always got to be aware and watch out for anything that can change and become dangerous to you. Determine scene safety. This is the most critical thing you can do on any call, and it's the first thing you do. You can come in contact with hazmat, hazardous materials. Your primary rule here is to maintain a safe distance from the source of the hazardous materials. All hazardous materials are supposed to have placards on them. This will ensure that people know what they're going to potentially come in contact with. Make sure you have binoculars, because then you can look for the placards. It's required equipment on Illinois ambulances. And then you can look with the binoculars, and those placards will correspond with coded colors and identification numbers, and you look in what's called the Emergency Response Guidebook. They're updated by the U.S. Department of Transportation, and it's got every hazardous material in it, and you can look it up and see how far away you need to stay and what the guidelines for care are. So, your role as an EMT, underline this, is recognize potential problems, take actions for your safety and the safety of others, and then notify a trained hazmat material response team so that they can come in and deal with the incident. But your role is just to recognize, take action, and then notify somebody else that's got higher training. Don't treat any patients until after they have gone through decontamination. You don't want to contaminate your ambulance and then it's totally out of service. So, terrorist incidents is another thing. They're becoming more and more frequent. They can be on a small scale or even a large scale. And some terrorists are using chemical agents. A nerve agent called sarin is SARIN, can cause reactions to the nervous system. There's biochemical agents out there, radiation or explosive devices, and these are things that you might potentially come in contact with. And then we've got rescue operations. You will have car accidents, fires, explosions, electrocutions, where you may have to remove patients from whatever's wrapped around them and extricate them. You got to evaluate each situation and ensure that you've got the properly trained people there to do what needs to be done. Don't ever do something that you're not properly trained to do. So here's a police officer. He's looking with his binoculars at placards that he might potentially be hurt if he was to go into that scene without checking to see what he's entering into. Violence. Sometimes there's people out there that are in a violent state. So you need to plan and wear safe clothing, prepare your equipment so it is not cumbersome, carry a portable radio whenever possible, and decide on safety roles as for those that are responding. The EMT directly involved in a patient care should always be aware of what's going on around them, but not always. So if you have an extra person and keep somebody that's watching your back. Sometimes you miss things that are going on when you're so focused on the patient. They call that tunnel vision. So don't get caught up in tunnel vision and miss things that are going on around you. So as you approach potential situations, you don't know who's behind that door, so approach in a safe manner. Stay off to the side. Observe. So survey the scene when you approach. Don't announce your arrival. Turn off lights and sirens. Stay back until you know the scene is safe. Maybe drive a few feet past residences so you can see the front and sides and all the way around. And then observe for any violence. Look out to see if there's any crime scenes. Don't disturb. If you get into a crime scene, don't disturb anything unless it's necessary for patient care. If there's alcohol or drug use, when people are under the influence, they're more likely to be unpredictable. And so don't get all caught up in, oh, well, he's just drunk. There's some dangerous drunks out there. Watch for any weapons. Remember that any item can be used as a weapon. So if your patient, contain them to one room too. They can wander around, sometimes pick up something that can be dangerous. Family members, emotional or overwrought family members can actually take out their anger on you, and you don't want to get hit upside the head by a family member that's upset because their family member is dying. Bystanders. Sometimes people gathering at a scene in groups can feed off each other and become violent. And then pets. Pets can sometimes distract you from or even interfere with patient care. You're working on their loved one and they're pretty loyal and they might be okay, but when you're taking care of them, that might upset them. So, when there's danger, there's 3 R's to react to danger. Number 1, retreat. Get back. Think. Stay out of the way. And the next one is have a radio. Radio to somebody that can maybe bring help. And then reevaluate. Don't re-enter the scene until it has been secured by police. So, observe. Look and see what's going on. And then flee. Get rid of any cumbersome equipment. Don't worry about taking your monitor or your bag with you. It's heavy. It won't help you to run, so just leave it there. Your life is more important. And then take cover and conceal yourself. Taking cover means to find a position that protects your body from anything that's thrown or projected or guns, shots. So you get behind a brick wall. Concealing is making sure that they can't see you. Something that can conceal you. A shrub. So concealing yourself is placing your body behind an object that can hide you from view. Covering yourself, taking cover, is protecting you from anything that can be thrown or hit you or shot, shots. So your chapter review. Your well-being is an important concept. This chapter has provided several ways to protect and maintain it. You should never take safety or standard precautions lightly. Each is an important decision you will make at least once at each scene you respond to. Always. So always play it safe so you can go home to your family. Protect yourself from violence and scene hazards at all costs. Protect yourself from disease. Don't be paranoid about catching a disease, but just take appropriate actions. You don't want to get sick, even if it is just the flu. Stress can be an immediate reaction from a particular call, or it can accumulate and be a combination of just your life and the stress of EMS. Both of them are stressful, so seek help if you need to. You might see some death. You might have a reaction to death. It depends on your own personality. The stages of death are denial, anger, bargaining, depression, and acceptance. Treat people who are under stress fairly and compassionately, even if it's hard to do so. Scenes are dynamic. They can change in any instance. So assess the scene and keep assessing it. It's an ongoing process. And don't be so focused on the patient that you lose perception of what's happening around you. What precautions must I take if I'm dealing with a patient who has an open wound? Well, at the very least, you should be wearing gloves. Gloves will protect you from getting anything in any cuts or mucous membrane openings you have. What can I do to help deal with stress? Take some time off, have some time to yourself, have a hobby, relax, eat right, exercise, have a good support system, family and friends. A patient who refuses to believe she has a terminal illness is in what stage of dealing with it? I would call that denial. That's the not me phase. So you're called to an unknown emergency at a tavern. As you approach the scene, you see a man lying supine on the parking lot, apparently bleeding profusely. Two other men are scuffling and one seems to have a gun. What actions must you do? Well, your safety comes first, so you need to retreat and then radio. Put yourself where nobody can see that's going to, potentially harm you. Now, there's a guy bleeding profusely, so he may bleed out before you get to him. If you can holler at him and give him instructions to bleed to treat himself, maybe that might help him, but it doesn't sound like that's the case. You definitely want to protect yourself though first, and then your partner, and then bystanders.